We definitely seen people on vents less. You know, the time has been shortened that they were on vents. I don't know the exact numbers, but you know, they publish it in their break room, so they see the trending down of people on vents less,
Great.
which is very good.
I think this month we're down to average of like 1 day for an event, which is pretty substantially better than a lot of the other hospitals in our area.
The patients.
I feel like they have more autonomy with their care, and they're able to, you know, tell us what their needs are instead of just assuming them from them being super sedated and everything. So it's been really nice for them to be able to communicate.
And nice for families too to communicate with them too.
Yeah.
It's nice to be able to have that interaction.
This is just stuff we really haven't asked, but
Yeah.
for the most part, like
Yeah.
it's just kind of necessary things to them that we just don't really see, or we do the oral care, but we don't always put pillows under their everything, or we turn them exactly how they want to be turned. So it's just little things like that.
I feel like, yeah, it's definitely changed for the better, because you just know exactly what they need, and it's less time in the room when they're able to like write it on a board and they know exactly what they need instead of just like guessing sometimes, not able
charades,
to.
trying to figure out.
Yeah, we're a little bit stronger to. Not everyone can legibly write still, but you can like point to letter boards.
Yeah.
But
And then you can educate them too more. Under today they're not learning, so you can teach them what the tube is. Why?
How's that been going? The orientation to the ET tube.
I feel like it's better responsive too,
Yeah.
to like not really go for it anymore, and
Great.
I think they really know that it is helping them breathe
Yeah,
for
less
the
patience
short
and
term.
restraint.
Because that was a big fear for
Yeah.
everybody when we started,
Yeah.
right? Is they're going to go and they're going to
Yeah.
self-extubate. But your experience has been that actually,
It's been
for the most part, they don't.
Yeah.
pretty safe. Yeah.
self-extubation is a lot of like you're waking up from like unawareness that you're scared, and it's just like your natural instinct. People they understand it once we explain it, and they know that it's important. Everyone's been doing a really good job at
It
that.
sounds like people are much more communicative, much more awake. How has that experience been for you as nurses?
I do appreciate the we extubate people quite quickly now, and they are like not delirious at all afterwards, which has been nice.
It's been a lot easier too to kind of assess them as well throughout the process as well. We don't have to turn the sedation off to then reassess and everything. So it's been a lot easier, once you get used to
A
it.
different approach, not starting with propofol, starting with like Presidex or pushes of something instead of just going straight to the probe drip. Very
It's a
much
lot
so.
more calm.
So you feel the whole work environment is more calm, the patients are calmer. And as far as time, that was the other big concern, was it's going to take more time. What's been your experience in terms of the overall workflow? Talk to other nurses who are worried about this not being doable because it takes too much time.
Once you get used to it after a couple weeks, it is quicker. You get more used to it. You can do your SBT, SAT earlier in the day and push it off, and you can come to it quicker.
And I think the education wise too, it can be a lot more extensive in the early on, because they actually ask questions now and everything, and the family's involved as well. So it can be a little bit more work in the beginning, but then your back day is a lot easier, because they kind of understand that this tube's helping them.
Great.
This is going to be what we're doing for the day.
I feel like we came as a group, especially in PTOT, to mobilize people, even if it's just like trying. Like I had somebody that was intubated, and we put him on a master vest, and we tried standing him up at the side of the bed, and it just did not work. But we he was tired out afterwards because he hadn't sat up at the edge of the bed and since he got admitted. So even stuff like that is like important to try.
We talked to the therapist first, and they said that they loved the teamwork.
Yeah, I think we've always had a good workflow together, but even more so now, we're on the same page. I think we were worried about the communication aspect of it too, but that's been smooth. Yeah, all working together, setting a plan, setting a time, and
Getting stronger.
Yeah.
Sure.
What would you say to the next group?
it's not as intimidating as it seems. Like
I was in their shoes. I didn't
Yes.
want it. I did
Yeah.
something I
For
thought was
sure.
going to do great.
It
but-
seemed a lot more daunting and challenging than
Yes.
it actually is. And then it's just nice to see the benefits for the patients and how quickly that they're improving and getting extubated and everything. So it's still a lot of work, but it's beneficial for them.
It's worth it for the
I
patient.
think it's quicker too once you starts to be second
You
nature.
get-
I feel like
you
we've
get
gotten a
used to
lot
it.
quicker at doing it now.
It's been nice. I mean, you can just tell their personalities even when they can't talk, when they're like communicative and able to tell you what their needs are. So it's kind of cool to see how they actually are. And
It's just incredible seeing someone walk in the vent in the halls.
yeah.
It still catches me off guard.
Yeah.
Every time I look over, like, oh,
A year
how's it
from now,
going?
guys, it's going to be just the way it
Yeah.
is.